Getting more for less is pretty much the order of the day in every area of public services. That's certainly true of healthcare. The Centre for Better Managed Health and Social Care at Cass is having its annual debate on the 26th of October. Opinion formers from all over Europe will be showing their faces and influencing policy in the UK. Of course, one of the big questions for users of the UK NHS is, why do we need healthcare change at all? They're very happy with the service as it stands. Professor David Welbourn is in charge of the debate. Professor, why do we need change?
Yes, in fact there was a recent survey that showed that the UK health system is amongst the most efficient and effective use of resources within the health system, and that's great. And we've actually been seeing a lot of improvement in fundamental care over the last few years. Some of the best improvement in heart disease of any country. But the problem is not about today, the problem is about the future, and the fact that an increasingly elderly population is making increasing and continuously growing demand on healthcare. Something like 70% of the total cost of healthcare involves diseases of old age, and as people are living longer, people are making more demands on the service, and whilst we have got a good service today, that simply is not sustainable without doing something differently to get better quality and better efficiency out of where we are.
A lot of opponents of change will say this is a free market-loving Conservative Party trying to force change on the NHS for ideological reasons. Is that true? Well,
I don't think that's true. I think there are significant benefits of competition in the same way as there are significant disadvantages of competition. And what we're trying to stimulate in the debate is an understanding of what is good and what is not so good. And it's not ubiquitous competition. And we need to understand that there is already competition in the system. There is already a significant amount of healthcare is delivered by private companies. Most general practitioners are independent small businesses. So it's not fundamentally about privatisation. It's not fundamentally about competition. It can be seen as that if it's done dogmatically. But the real challenge is, well, what is there in competition that is helpful? And what is there in competition that's maybe not helpful? And there is no doubt that an entrepreneurial environment that competition brings and generates is that innovation, the health system is woeful at taking good ideas and spreading them. And innovation is probably the biggest thing that we're short of in the health system. Not new ideas in pockets, but actually embedded ideas turned into practice and put right throughout the whole system. And competition is probably one of the best ways of expediting that.
It's fair to say this annual debate is becoming part of the process. You've got opinion formers taking part from all over Europe. Just give us a taste of what we can look forward to.
It's a place where we want to bring together academics and practitioners right across the whole system. We want to create an environment where people with different ideas can come together and can share those ideas, and more than anything, stop the increasing trend of jumping to conclusions and sitting at one end or the other of a polarised debate, that people have made an emotional commitment to the NHS and therefore they sit at one place or another. And the reality is that there is a lot of evidence that simply isn't informing the debates. And we are very keen to bring together different perspectives, different views, and everywhere else in the business world, the more different perspectives you can bring around a problem, the better, the more rich the solutions are that you find. And so we see our role in the centre as creating that rich encounter between the different perspectives, and let's find the whole being better than the sum of the parts of the three policies that we're looking at. So we're looking at competition, we're looking at regulation, and we all know where the regulator sits at the moment, having a high-profile number of failures that they haven't addressed adequately. That's the public opinion. Let's hear what's going on. Let's hear the challenges of broadening the base that they are seeking to regulate. How can they do an effective job of regulation when the demands upon them are growing much greater than any resources that they've got? So that's part of the debate. And the other part of the debate is standards. We know that NICE are hugely respected around the world for the work that they've done in moving forward standards and objective evaluation of what is best practice and what is how we get best value out of medical advances. And so we're having the debate with those three topics: competition, regulation and standards.
Professor David Welbourn, thank you very much.
Thank you.